Hi, welcome to the Flu Lead webinar, Preparing Your Community for the Flu, hosted by the Healthcare Resilience Working Group and led by HUD, HHS, CDC, CMS, ARC, and a bunch of dedicated health and housing professionals. To get us started, I'm going to go to Jason Amirhaji with HUD. So Jason, take it away.
Thanks so much, Bob, and thanks to everyone for joining. I'm very pleased to introduce all the folks on today's webinar, so apologies for the delayed start, but I think we'll be able to fit it all in. But to kick it off, I'm very, very happy that we can have our Assistant Secretary for Public and Indian Housing, Hunter Kurth. Hunter has been part of HUD in various capacities, really, for this administration and then even before that, and has helped really support a number of our health initiatives, including the Flu Vaccination Partnership. So I'll hand it off to Hunter to just briefly share the importance of this year's flu season.
Thank you, Jason. And thank you everyone for joining us. Before we start, just to say, really thank you for all that you're doing each and every day. This is some very trying times in both the health and housing fields. Are really folks that are on the front lines of dealing with the COVID pandemic. And I really think that the pandemic really highlights the importance of getting the flu vaccine this year. As we prepare for hopefully a rollout of the COVID vaccine in the near future, this is a really sort of good test case and really sort of important way to get us kicked off into that, but also just to deal with and combat the flu itself. I mean, it's with all the other health issues going on right now with COVID, it's really important that we ensure people are vaccinated against the flu so we don't see a uptick in hospitals and other things like that. What is exciting is that it is we're just a few weeks away from National Influenza Vaccination Week, which is the week of December 6th to 12th. Again, a really good time for us all to highlight the good work that we're doing to try to encourage folks to get the vaccine or the flu shot and the flu vaccine. And I really think that I'm excited to hear what we have to say today. And I just want to thank everyone out there again for the collaboration that they have between housing providers and healthcare centers. It's just, like I said, more now than ever, incredibly important that we're working together as we get ready for the flu season, as well as we prepare for the COVID vaccine. So thank you all for joining us. I'm excited to hear what everyone has to say, and I'm going to turn it back to Jason.
Thanks so much, Hunter. Really appreciate it. And now very pleased to introduce Maren Sig, who's our leader of the Health Resiliency Working Group, which is the sort of interagency federal group that is working on this piece of the national COVID response. So I'll hand it over to Maren.
All right. Thank you, Jason. Can everyone hear me?
Yep.
Okay, excellent. Thank you, Jason, for your kind introduction. Next slide, please. All right. So I think we all understand the importance of flu vaccination this year to avoid a twindemic, which could increase respiratory-related morbidity and mortality and further strain our overburdened healthcare system. So right now, as there's not yet a cure or a vaccine for COVID-19, but there is something available to us at the moment, right now, to avoid the twindemic of seasonal influenza. And that is the flu shot. This year, it is more important, more than ever, for our communities to have safe, convenient, and affordable access to the influenza vaccination. Providing access to flu shots saves families in our communities. It also protects our first responders, hospital workers, and scarce medical resources. It's vital to note that every influenza test, diagnosis, or hospitalization reduces critical health system capacity for COVID-19 patients. So now more than ever, we need to focus on providing these shots to our communities. Next slide, please. So according to the estimates from the CDC this year, 60,000 lives could be saved, 700,000 hospitalizations could be avoided, and 26 million medical visits could be prevented this year alone. Every year, we have 50 million people catch the flu, And there's only one safe and effective way to prevent it, and that's by getting the flu shot. Next slide, please. All right. So the CDC recommends, and they've been recommending this for years, an annual influenza vaccination for everyone 6 months and older with any licensed age-appropriate influenza vaccine, with no preference expressed, obviously, for any one vaccine over another. This is a figure that's also derived from the CDC, looking at flu vaccination coverage by state in adults during the 2018-2019 flu season. As you can see, there's a large between state variability in flu vaccination coverage among adults, ranging from 33.9% in Nevada to 56.3% in Rhode Island, as depicted in the figure. It's also worth noting that the US as a whole was at 45.3% in terms of flu vaccination coverage among adults during the 2018-2019 flu season. One interesting observation, though, is that of the 10 states with the lowest influenza vaccination coverage for children, 8 were also among the 10 states with the lowest coverage for adults. So, you know, adult and child influenza vaccination coverage estimates by states were positively associated with healthcare access. Healthcare access shows a consistent, positive, and significant association with influenza vaccination coverage at the state level across all of our populations groups. We've also noted that higher socioeconomic status and high educational level has also been associated with increased influenza vaccination coverage. And now I will turn it over to Dr. Justin Mills, who is also a member of the Health Resilience Working Group and is a pediatrician and medical officer at the Agency of Healthcare Research and Quality. Justin, over to you.
Thanks so much. Really appreciate it. So now, if you want to move to the next slide there, I'm just going to spend a little time talking about communications and messaging for influenza vaccination. So, you know, the CDC has spent a good amount of time doing testing and really thinking about kind of the best ways to message this, and really kind of stressing that this year the flu vaccine is more important than ever, especially to avoid what we consider or we're calling a twindemic of flu and COVID. And to do that, they've kind of really focused on 2 different campaigns. And so I'll talk about those real quick. What you'll see across both those campaigns really is kind of a consistent messaging. So, you know, the CDC actually worked with a number of organizations to do some messaging testing to kind of see what messages really worked well or were the most persuasive to different groups. They really focused on 3 ideas. The first is protect yourself. The second is protect loved ones. And the third one is protect communities. And so when you're kind of looking at some of these materials, if not now, later on, you can kind of see kind of that messaging across all those materials. The first one that you'll kind of see here, there's the CDC messaging and CDC campaign. That's really around two things you'll see: hashtag sleeves up and then hashtag fight flu. When we get to this in a couple of slides, you'll notice that, or we'll talk a little bit about some of the materials that we've curated and we can link to that will have some of this information, some of these materials. These include print materials, but probably more importantly in our current day and age, social messaging, banners that can go on your webpage, things like that, that are helpful. The second campaign that I really wanted to touch on today from the CDC is called No Time for Flu. So this is a campaign that's specifically geared for our time. So with the COVID in place and whatnot. And this is actually a collaboration between a number of different groups, including the American Medical Association, the Ad Council, and the CDC. The focus of this really is on African American and Latinx communities. We've probably seen from some of the data, and I'm probably aware of this, but we know that these 2 groups, especially African Americans and Latinx communities, have lower rates of vaccination coverage. I think for African American communities, it's around 43%, and for Latinx communities, it's around 52%. So that's significantly lower than what we're seeing in the non-Hispanic white population, which is around 63%. So that disparity is concerning. The other thing that they found when they were looking at some of these numbers and really talking to people about why or why not they were going to get flu is that really about 40% of African American and Latinx community members were uncommitted. And some of those are uncommitted to getting flu vaccine, I should clarify. And so while that is somewhat concerning, it also gives us an opportunity to really focus on those and kind of persuade folks. And again, we know, and I'm sure you know, that there are a number of reasons why these communities are less likely. Access to care, ease of getting immunizations, and then also we have to discuss kind of the historical distrust of the medical establishment, particularly among the African American community. If you want to go to the next slide. So here's some of the example of some of the materials. Again, we talked about protecting yourself, protecting loved ones, protecting your community, getting a flu vaccine. And again, the versions of these can be found on the CDC website, which we will provide kind of links to, and you can kind of take a look at those. If you want to move to the next slide. So here are some of the materials that we've put together. So, through the Flu Lead program and this project, we really tried to do a number of things. And one of those was to curate some of these materials that are out there. We understand that there are a number of organizations that are going to be very comfortable with doing a lot of this stuff. But we do understand that there are organizations that may not have experience with that. And so kind of the good news is that, there are a lot of groups, both governmental and non-governmental, that are working on this and already have available resources. And our goal really wasn't to reinvent the wheel, but to kind of find those materials and make it easier for you all to be able to access them and utilize them. And they've kind of been grouped into two different kind of spaces. One is around kind of that advocacy and getting people out to get flu vaccine, but then also there are materials for those who are providing or actually giving the vaccines themselves around how to do some of these things, like reach out to other communities, mobile vans, off-site vaccine clinics. So we really tried to kind of curate and provide those for you all. And we'll provide these materials and a link to these that we'll update kind of frequently to make sure you guys are aware about that. And then kind of lastly, again, I just wanted to push kind of the National Vaccination Week, which is December 6th through 12th. You should start seeing some of these materials kind of on TV and media and whatnot. And with that, I think I will turn over and hand off things to Bob Burns, who talked very recently. He's the director of the National Center for Health and Public Housing, and he's going to talk about partnering with health centers. So, Bob, go ahead. You may be muted if you're talking.
Sorry, guys, I was on mute. Yeah, anyway, I'm really thrilled with the progress that's been made as part of this effort in actually partnering between, federal agencies on the national level, namely HHS and all its parts and HUD, and on the local level between public housing agencies and health centers. It's really the kind of synergy that we've been working toward for a long time. And I think this whole initiative will reap great benefits with respect to, getting vaccines out, first for flu vaccine, and then hopefully some of this is helpful to us in the next vaccine rollout for COVID-19, and we can use some of those lessons learned. And I just want to mention that as part of this, it's and kudos to the health centers and housing agencies on the local level who've stepped out and taken this on, because it's a brand new program, it's a new path, and so there have been a need for some creativity and some extra effort on the part of all. I guess I want to say some great things about the people in Region 6 and about Jerry Whitaker and the people at North Area Texas Health Center, and they're going to talk in a little bit. But I think that this really bodes well. And I think one thing I would just say is that let's start preparing for next year now. And next year, I think it will be just outstanding. And I think we can do great things this year, but even more for next year. And I think the partnerships past and that in the past have helped us with this. And I think this will help us generate a lot of new partnerships, which is going to improve overall health outcomes for HUD-assisted folks and public housing residents across the board. And I will just say the National Center for Health and Public Housing has mapping capability and is willing to assist anybody on the health or housing side who needs it in terms of coordinating any kind of activity relative to this. And at this point, I'm going to turn it to Constance Bennett-Williams of Region 6, who's been doing such a great job working with the health centers in the region, and particularly in Texas, to get this underway. And again, Constance, take it away.
So Constance, sorry, this is Jason. Just before you do that, I just want to click through a few resources for folks to keep in mind as we have our communities presenting different examples throughout the call. This is Vaccine Finder, vaccinefinder.org, and it's a site that's linked to from the CDC materials, but you can use this as a community, or individuals can use this to actually locate vaccines near you. So you can put in your zip code, and it highlights different pharmacies, medical providers. Bob talked about health centers, and you'll hear some examples of that today. But it also includes, urgent care and different locations within the community with community-based organizations. So this is one resource to have on your radar. Another one, just to the federally qualified health centers and other health centers that have public housing primary care grants, or that are located in or immediately near public housing, or that serve HUD-assisted populations. HRSA has a Find a Health Center tool that's linked here that you can use to actually locate a health center in your community. So these are two great resources that you can use to kind of find partners if you don't already work with a partner to provide not just influenza vaccination, but other health services, and hopefully build partnership toward an eventual COVID vaccine, when that's available. And just a quick note here, folks probably know this depending on where you're located. This is just a map of the Medicaid expansion in the country, which does affect sort of the cost component for folks. So if you are located in one of the non-expansion states here that's located in a very light gray, that does mean that working adults in your states may be sort of left in the coverage gap, where they don't qualify for traditional Medicaid and don't have employer-provided insurance and don't have a way of buying in as they do in the other states. So this can, and you'll hear from some of the sites talking through today how they've dealt with that challenge, but just something to think about when you work with your partner is that there's a funding gap there that may need to be filled so that people don't have an additional burden of cost when it comes to providing the vaccine. Another note here is that even in some of the states that have expansion, in those states, adults who are covered are guaranteed access to a free influenza vaccination, but of course they still need to be insured. So, it's important now as we enter open enrollment, for folks to make sure that they get onto the exchange and register if they don't qualify for traditional Medicaid or Medicare and Medicaid, which we'll talk about later. All right, and then just last resource here, which you can download from this deck, which will circulate, and also it's available on the resource page, is just this guide that talks about different community organizations and outreach strategies, and we'll have some examples later of ways to do outreach. But thinking of a multi-pronged approach whenever you're doing a campaign like this, so that you can get the most turnout and really help to make your efforts worthwhile, so that people can, I think, be met where they are and made aware of the sort of urgent community and individual health need of the influenza vaccine at this time, to avoid the Twindemic and also to protect their communities. So this is just the information that Bob talked over for NCHPH, and again, it's all linked in there, but they're really a great connector between public housing and health centers, which is a big goal for this effort. So just moving on to the community examples, Constance, do you want to take it over?
Absolutely, thank you so much. Hi, as Bob mentioned, my name is Constance Bennett-Williams, and I'm the site lead for the Fort Worth Envision Center. For those of you that are not familiar with Envision Centers, in short, it is an initiative of the Secretary of HUD, Dr. Ben Carson, that serve as centralized hubs that provide people with resources and support needed to be self-sufficient by focusing on 4 pillars, which are economic empowerment, educational advancement, character and leadership, and health and wellness. The Fort Worth Envision Center, which was designated in May of 2019, is a collaborative partnership between the City of Fort Worth Housing Solution, and the Fort Worth Independent School District, and is currently housed in the MLK Center, which is within walking distance from the Cavill Place, which is a Fort Worth Housing Solution public housing community. Our local HUD office has been working collaboratively with the North Texas Area Community Health Center, who is funded by HRSA. And this is particularly important for uninsured and low-income individuals that are served by HUD and the Envision Centers to get the health services that they so richly need. In moving forward with the flu-led project, many meetings and conversations were conducted with the CEO of the North Texas Area Community Health Center, Jerry Whitaker, and her team. And we were kind of talking about some of the challenges that you heard, Texas being a non-expansion state, and how we could get the people the flu shots or the flu vaccines. So Jerry Whitaker was very, as you can see, she's very persistent. So she was able to connect with her partners at the Tarrant County Health Department. And as a result, we were able to secure the commitment of 200 flu vaccines that are being targeted specifically to service Envision Center clients, both in Fort Worth and in Arlington. The coordination of the Fort Worth Envision Center is also leveraging a partnership with the Transit Authority in Fort Worth to secure free transportation to the flu vaccine site. So in addition to receiving the free flu vaccines, they're also going to get free rides to those to get those shots. Additionally, Jerry has already reached out to me about furthering our partnership with providing COVID-19 testing to those individuals that are serviced by the Envision Center as well. So I look forward to a long and prosperous relationship with Jerry and the North Texas Area Community Health Center. So now I am very delighted to introduce the CEO of the North Texas Area Community Health Center, Ms. Jerry Whitaker.
Thank you, Constance. I'm happy to be here. I just wanted to talk a little bit about the nature of the partnership that we hope to develop. We are very interested in providing flu vaccines to all of our patients, as well as becoming a medical home for those folks that are frequent in Constance's group. We provide a full range of community health services. We provide services to the insured, the uninsured, and completely those folks that are not necessarily documented. And in Tarrant County, that is a problem for many folks who don't have a Social Security card to get health care in the county system on a consistent basis. So one of the things that we're interested in is providing a medical home to those folks at the Envision Center. The health center has done a needs assessment of the zip codes that we cover, and what we have found in our needs assessment is that in terms of health disparities, those folks in Tarrant County are 7 out of 7 in terms of diabetes disparities, 6 out of 7 in terms of hypertension. So we took that information and developed a program with a partner, with a foundation partner called the Morse Foundation, and developed a diabetic program specifically for those individuals who were unable to control their diabetes. So anybody with an A1C of 9 and above, we're interested in putting into the program. It's a year-long program to work with them to get those A1C levels down. And inevitably in our community, those folks that generally have diabetes also have comorbidities, including hypertension. So we are also working with HRSA to develop a hypertension program to partner with a diabetic program. I'm happy to answer any questions, but we find this partnership to be a very valuable partnership. Our goal is to take care of the folks in our community. We have set up a different type of program, I think, in that we want to invite folks into our health center. We don't want to do a drive-by. What we want to do is to invite them in, give them their flu shot, and talk to them about their general health and talk to them about becoming a part of the Intech family in terms of becoming a patient that can utilize all of our services. So with that, I'll turn it back over.
Thanks so much, Jerry. So again, this is, I think, a great example of collaboration and working through challenges. We have a couple other great site examples, and of course, Envision centers are not just limited to public housing residents; they're open to, voucher recipients, community members from the surrounding community, and we actually have a lot of sites that fall under multifamily that are actually for seniors. So I'm just going to go back. So we have Debbie, who's with us here from CMS, and she, I think if you're on the line, Debbie, can present a little bit on just how folks can use, their Medicare coverage and the dual enrollment coverage, Medicare and Medicaid, to get access to the flu vaccine.
Thanks so much. Happy to be here with you. As we've heard earlier, the CDC vaccination, data all points to how vaccinations can help lower the impact of influenza, and more importantly, in the year of a potential twindemic with strain already on our burdened healthcare system, this becomes more important. Add to that any warnings about the public health emergency and efforts to reduce the spread of COVID, so things like physical distancing and staying at home, really has led to decreased use of routine health and preventive health services, particularly immunizations for children, which are really essential in protecting people and communities. So people may be hesitant to go out into the community, likely need a lot of assurance that places that do offer vaccinations, like pharmacies and clinics and doctors' offices, are safe and that they are taking appropriate precautions. So we are very geared into sharing those kinds of messages with our populations. But this year we are working especially hard to identify through county level data some of the most vulnerable populations, like seniors, dually eligible Medicare and Medicaid, low-income elderly, racial and ethnic minorities who already face disparate services in healthcare, like African-American populations and Hispanic populations. So we've done a lot of message testing to our populations to see what kind of messages resonate. For Medicare in particular, it's important to emphasize that Medicare does cover the cost of the flu shot. People pay nothing, out of pocket for that. We've been using some of the tactics like digital video, banner ads that bring people using certain search words, keywords, to our Medicare.gov websites. We've done, again, in our targeted areas, radio, national and local radio and media ads, Facebook ads. We use our standard channels like Medicare.gov, but also emails, Medicare summary notices. We use our health plans, our providers, our pharmacies, and provide all of those partners with social media toolkits, drop-in articles, messaging, anything they can use, posters, flyers. In addition to that, CMS does have the Medicare and Medicaid Coordinated Office for the Duals. So we call it the Office for the Dually Eligible. And every year they conduct an annual flu campaign, a postcard campaign. It's a direct mail to consumer. And we have postcards on our website that can be downloaded and used in over 12 languages. Last year, in the last 3 years, I think we did 4 states. We expanded this year to 10 states and over 400,000 plus beneficiaries in those 10 states. A direct mail encouraging them in the language that they speak. So whatever primary language, the postcard is produced and sent directly to them, encouraging them to get a flu shot. We post those postcards on our CMS website, and they're available for anybody to download. But more importantly, we are relying on our partnerships with trusted voices in the communities to reach people who are already providing a service, who are already in the community. And we hope that you'll utilize these and share these with your colleagues and partners. Thanks so much. Turn it back to you.
Thanks so much, Debbie. And I think the key takeaway that I got is that for seniors who are Medicare covered, that this is totally free, and that there are some great resources that you have available on your website for folks to use to help with outreach for those communities, and so that those are materials anyone can access. So thank you. So I want to hand it over now to Linda from Leading Age, who supports and represents many of the multifamily sites, including one of the examples we have here today.
Great, thank you. Leading Age is a national association of more than 5,000 aging services providers, and we're pleased to participate in this important webinar. Our members represent the full continuum of aging services providers, including affordable senior housing. The slide on the screen is indicative of the work we do, supporting affordable senior housing providers and the residents they serve with the services older adults need to age successfully in community. HUD's programs serve more than 1.5 million older adults, about half of them through HUD's multifamily housing programs. HUD multifamily affordable housing programs, I would say, to every single one of those providers really work diligently to help older adults access the services they need, including flu vaccines. And today I am really pleased to introduce to you Roland Broussard with Leading Age member, Elderly Housing Development and Operations Corporation, which owns and manages HUD-assisted affordable senior housing in 15 states and Puerto Rico. So over to you, Roland.
Thank you, Linda. Good afternoon, everyone. How are you? As EDOC strives to create diversity in our independent living facilities across the country, maintaining a mission of aging in place is the new conceptual rule for the most part. We've done everything to expand on that and capitalize on doing what we can to enhance the lives, the health and wellness of our residents. An example of this, which we're trying to model across the country, is in partnership with local medical centers or hospitals in bringing in a health and wellness center in our buildings. The screenshot you see there is an example of one we've created in Fontana, California, to where Kaiser Permanente is about a block away. And then we did a study of our 150 member residents there that nearly less than a third actually went to the doctor to get a flu shot, which was quite alarming. So we ended up partnering with them, doing a joint venture and creating a pilot program with Kaiser Permanente where we would afford them the space in the building, free space, as you do with the Walgreens or the CVS's or the Rite Aids of the world. And it created a health and wellness center to where we are actually capture more residents by convenience. Again, we're a landlord in the business of providing quality, affordable housing, but we need to enhance those services whenever and wherever we can with local partners in the community to make sure it works. And in fact, this did work very well. COVID unfortunately has put a hindrance on it for the most part, but the relationship remains committed with the Kaiser to move forward with expanding it when we can and are able to safely, including the distribution of any hopeful COVID vaccine that comes in the future. We're trying to model this across the country with other providers, Miami, such as Jackson Memorial Hospital. We're trying to look at similar programs in Chicago. And this is in addition to, this is in addition to what our resident service coordinators in the field do every day with the partnerships created with the Walgreens or the local pharmacists, the local doctors, or the local health service providers who come in on a regimented schedule annually to do flu vaccines or other type of inoculations. I've got joining with me on my call today is our Vice President of Quality Assurance and our Vice President of Field Operations, Melissa Tarrant and Della Colster, who are going to elaborate more on what we do on a regular, consistent basis outside of these pilot programs that we're doing as far as part of our ongoing aging in place concept. Della, are you free?
maybe having a connection issue there. But I think this is a great example, Roland, of just not only, partnership with a local managed care organization in Kaiser, and despite the fact that they're just, as you mentioned, down the street, the value of having something on site and working with them to provide that, especially for senior populations. So this sounds like a model that other sites could look to replicate based on the resources in their community. So I know we're running a little bit behind, so I might just click forward, but if you're able to get the connection back on, we can come back. But thank you so much. Really appreciate all the work that you're doing. And very happy now to introduce from Camden, actually, Renelle and Kathleen, who are working together at one of our HUD Jobs Plus sites, which is Ablett Village, to help connect folks with resources for health. So this is a slightly different model, right? This is a public housing community, and this is not a FQHC, but they're working with the School of Nursing and a nurse-led practitioner. Renelle, do you want to take it away? And Renelle, you might be having connection issues as well. So Kathleen, if you're on, you
yes,
can go ahead and just.
I'm here, and I sent you just a couple little slides too. I don't know if you had a chance to.
Yeah, this is, I think, folks, maybe you can just speak to it. And then this is just some examples of, I think, for the community, one of the key needs I know Renelle was going to speak to is just that, this is a multilingual community. And so making sure to do, outreach in the community that in both languages and to make sure to have people who are able to speak to those. But go ahead, sorry.
Well, anyway, I'm Kathy Jackson. I am one of the faculty at Rutgers School of Nursing Camden, and also a family nurse practitioner. And we are working actually in several communities in Camden, one of them being Ablett, where we have some space on site to actually provide services on site. And I'm kind of reiterating, I think, what I've been hearing. I'm actually going to pull up my little slides myself here. Reiterating what I've been hearing, and I entitled my slides actually community engagement, and I put for flu vaccine there. And we've been in both of the communities in Ablett actually for a number of years, and we really are like you all have talked about, building partnerships for community health. So that's what we really work towards, and really building capacity within the communities to help improve their health. So doing that, we actually, for those who are starting out, sounds like you've been doing the same thing. We've met with the Housing Authority, we've met with the Public Housing Communities Administration. We've actually met with residents associations and members of the community, discussed what's needed and what we actually can provide for them, and meeting with community partners. And so in listening to everybody, I just want to, one of the things that I know happens in the Camden area, and we're actually a very small little city, about 10 square miles, but one thing that happens there is, we have our own silos, right? And we work, and we have this piece, and the Federally Qualified Health Center has this piece. We're really trying to work together and build, partnerships within the community. And we've done that for the flu vaccine. We actually work with the county health department, and they actually provide the flu vaccine. They provide the needles for us too, actually. And we use our consent forms, and they work with us in asking us how much flu vaccine we need every year, providing that for us. And and then we actually just return the information from the consents to them for that. But really looking at how we can work together to provide the services in the community. And originally we actually provided the flu vaccines within the community centers themselves. And now we have little health centers within the community, which are provided in kind space. Both communities have. And I think someone mentioned the word trust. And I think trust is so important. Both of these communities are, again, minority communities, vulnerable populations. About half Black, about half of that Latinx population. So really trying to reach everybody in that population. And part of that's just, it is getting trust over time. So going year after year and saying, hey, here we are to give your flu vaccines. Here we are to, provide other services within community. We do health education, other screenings, that type of thing. So really having those on-site services and getting the word out. So as you all know, it's hard to get people out, right? It's hard to get people out for everything and to convince them that flu vaccine is safe and it's going to protect them. And I speak from experience. I have over 40 years experience as a nurse practitioner, and I used to do employee health. And now you have to sign your life away if you don't want to get the flu vaccine as a healthcare provider. But back when I first started doing it, they could refuse. And I'm telling you, I get the same, barriers back then with healthcare with health people working in the healthcare industry as I do with patients now. It gives me the flu, or I've never had it before. Why would I have it now? And I think with the Twindemics, we have a little more we can convince them a little more, why it's needed. But that's one of the biggest barriers, I think, is really convincing people it's safe and that it's really going to protect them, particularly in this day and age. And so again, as other people have said, we have put flyers out. We use for dominant languages in the community, and we deliver by hand. We want to be seen in the community so people know, who we are. And we also we work with the housing authority, the residents associations, and Job Plus websites, so that our information actually goes up on their websites as well, and even just posting in the community offices there. So I think over time, just it takes some time to build that trust in the communities, and communities know that you're there, you're going to be there, you're going to be there every year to come and provide flu vaccine, and over time, what is best. And it's a win-win for us. We get to give to the community and work with the communities that are close to us in Camden, because we're Rutgers School of Nursing Camden. But also, of course, it helps us. We continue practice as faculty, and it serves as sites for our students that just learn so much by being in the community and working with diverse populations. So it's really a win-win for us as a school of nursing as well. So I think that was it for me. I don't know, Ronell, if you were able to get on, if you have anything to add.
I think I figured it out. Anyone hear me?
Yep.
Oh, finally. I was trying. I'm so sorry. Yes, just to piggy on what Kathleen has already stated, trust is exceptionally important. The program is Jobs Plus. I feel that we have very good trust. We're still establishing trust. And when you establish trust amongst the residents, they share the word. If it's something good, the word definitely gets out. But one of the larger barriers right now is fear. They have the fear of the pandemic. They're with the government with the vaccine trying to come, and then the flu shot and things like that. So the fear, education. I mean, education is ongoing. We have to constantly reiterate education about the plus possibilities to getting to the barriers and being able to have the convenience of having health care right on site. We listen to our residents. Transportation is a problem. Finance is a problem, the issue of the barriers. So we're trying to bring the services right to them.
Yep.
So
that's a good point as well, Ronell, that the county were able to provide the vaccine to people whether they have insurance or do not have insurance. So that piece is gone from it, because I actually had a colleague that said they went to CVS and there was some problem with their insurance. They ended up not getting a flu vaccine, and those kind of things are just so sad to hear. When are they going to get back again to get that flu vaccine? So I think the partnering with the county and sort of mitigating that barrier of insurance, worrying about insurance or cost really helps. Particularly when in going to vulnerable populations in inner city communities.
Thank you so much to you both. I mean, those are some great points that actually lead right into our next presentation from Los Angeles, actually Watts Health. And just to highlight a couple of things that you said that I think are really key is that coordination between housing and health centers, and then your state, local, whether that's county or city or tribal, entities, is essential so that they can, actually as much as 6 months in advance, back in the late spring, early summer, put in the order that incorporates people in public housing and HUD-assisted communities so that those vaccines are obtained, because those orders are put in early. And then I think, as you mentioned, the win-win for schools of nursing, because this isn't just a sort of benefit for the community, but it's also a benefit for the students. So it's a natural partnership. So folks may want to look to those entities as partners for something like this and other healthcare provisions. But I do want to build on the trust piece, and I'm very happy to have another one of our Jobs Plus sites, Bryant Crook, who's actually part of Watts Healthcare. And through Watts Healthcare, we have a community health worker partnership. So we have community health workers that are working on this, but also on other social determinants. And just a note, since we did start late, we are going to finish the presentations right at the top of the hour. But for folks who can stay on, we'll have Q&A after that for 10 or 15 minutes. So Bryant, go ahead, take it away.
All right, good afternoon, everybody. Can you hear me? All right, just want to share a little bit about what we do at Watts Healthcare. As we know, we're one of the first 5 community health centers that was founded back in 1965. And so our mission has been to provide competent, quality, and culturally sensitive healthcare to people in the community. And now when you mention the flu, especially now times of COVID, to get the vaccine out there, it's been a daunting task. We've been doing, I want to say, relatively good providing flu vaccines here at the health center. I mean, I think just for last month alone, I believe we did 304 flu vaccines. So I think the fact of the fear of COVID combined with the flu has made people want to get the test. I mean, well, excuse me, get the vaccine, so to avoid being compounded with COVID and the flu at the same time. So it's definitely a challenge due to the ongoing mistrust. I don't even say mistrust with everybody, but lately it's been a lot of mistrust with the medical and the vaccines and things of that nature. But I think it just takes due diligence, grassroots promotions, just to get the message out there to the community and let them know that it is safe, and better safe than sorry. That's what we kind of always say. You know, we want to be healthy and not sad because you're gone. So with that, we've been doing pretty good. That's pretty much the most stuff that we have to say. We're definitely looking forward to partnerships, to going to the housing projects, and to continue to administer the flu shots. But once again, here in Los Angeles and going to the housing projects that's around us, it has to be strategically done in partnership with those in the housing project. So that's what we're working on now. We got our CHWs out there on the front line, getting those things ready to make it happen for everyone.
Thanks so much, Brian. And one thing, I know that there's some audio issues, but if you can speak just in the last minute here to, which I think is really innovative about your approach, is that, looking at community engagement beyond just the healthcare provision. So we have up here, one of your flyers around like a gaming tournament. I think you mentioned also like a car show. And I know some of this is hard to do during COVID, but can you just talk a little bit about sort of ways of building trust and engaging the community, outside of the traditional healthcare delivery?
Yeah, definitely. That was the community health fair that we did. It started off as we used to always do something for Women's Health Month, but then never nothing for Men's Health Month. Then, men have been like one of the hardest demographic to get to go to the doctor. So what we did was kind of combine the 3 E's. We did entertainment first, and then we educated everyone. So what we did by entertainment, we had a big car show that invited people out, because I'm a car show advocate. I go to car shows because I like cars myself personally. And I was there one time. I just seen all the men that was there, and we was just like, wow, why can't we just test for hypertension, test for prostate, and just get these people educated why they're here in this in this entertainment avenue. And so we started off with that, and it started off roughly kind of slow, but then it grew over the years to where at the peak we had over like 1,900 people just come out to a health fair and got tested. And it wasn't just like, hey, come to the health fair, look at the car show, get in the carnival rides. You actually had to go through the health screening process first before you got access into the entertainment side. So that worked pretty good. But now, since times of COVID, we have had a health fair that was deeply had COVID restrictions, social distancing. You actually had to register in advance to get there. And we did that the weekend of October, 24th, 25th. We did it in Watts at the Freedom Plaza. That's a new shopping center that they just opened up on Saturday. Then Sunday, we did it in Lamert Park. That's another heavily populated African-American community in Los Angeles. And we were just basically out there providing free information. Flu shots was definitely offered. And it just dental screenings, mammograms, pretty much basic, the basic things you'll see at a health fair. We offered those, with COVID restrictions this past last month. So you definitely have to think outside the box and try to figure out what will work best in your state. By me looking at the map, it seems like Texas is kind of high right along with California, and it just might be a little difficult, but definitely the pre-registration in advance works tremendously. I would recommend everybody gate your area off, and then when you have admission in there, you have to go through the temperature scanning, make sure that they're on the actual list, as well as you space it out in between people that come into the venue. So what we did, we had 6 different screening tents, so we was letting a good 10 people in at a time, and made sure that everybody didn't start at the same screening area at the same time. We maybe had one person went to dental, one person went to flu, the other person went to your diabetes screening, one went to HIV, and you kind of strategically monitor it that way, and then I think it'll be successful. But once again, you won't get the massive crowds that you're used to having, but I think at least a little something is better than nothing.
Thank you so much, Bryant. Really appreciate it. I know we're at the top of the hour here, so we'll switch over to just for folks who can stay on. I know not everyone can, some questions, and also just throw up here contacts for the folks who have presented today. And also at the bottom, you'll see a sign up for our mailing list for Flu Lead to get more information about future best practices, webinars like this, and also a contact for more information about anything. And then most importantly, that last link on the bottom, which has our resources that are hosted on NCHPH, who we want to thank again for hosting the webinar today. So really appreciate everyone, all the great work that folks on this webinar have done, and the interest of people who are participating and listening in and thinking about ideas to help make these sorts of things happen in your community. So you can use the chat feature just to ask questions in the chat and to all panelists, and we'll kind of just try and take those, but understand that folks do have to hop off. So totally understand that and appreciate your all's time in joining us today. And while we're waiting for some questions to come in, I did want to ask just one question for Bob. As you work with health centers and housing authorities, there are health centers that are actually in or immediately near public housing that have the public housing primary care grant. I know a lot of those already connect with their local PHA, but what do you think is a good way to get started for those who don't have that connection?
Well, I guess two things I'd say is there are a couple of toolkits up on our site which deal with that very issue, but it all starts with communication. So, if you're a housing agency, reach to your health center. Start with the executive director, start with whoever's the lead on partnerships or outreach. It's going to vary a little bit from center to center. And then, sit down and I hate to say it, but the first step is to build that relationship up. and then go from there. Set your goals and objectives. I think as far as a partnership, one of the great things you can do is first get to know one another, and then to have some kind of success. So a lot of times, for example, in our toolkit, one of the things we always say is that if you want to form a partnership, or you want to do outreach to folks, you want to show them something or give them something. And one of the things we always recommend is just what Brian was talking about, and that's to actually do some kind of an event where you do screenings. And I know that's complicated. And the other thing is to give flu shots. So it's something that we've kind of advocated for the last 15 years as a means to what Jerry was talking about, Jerry Whitaker at North Texas Area Community Health Center. And that is, this is an inroad for hopefully a lot of folks to get into primary care, at which point this becomes, a matter of course, because then the health center as normal will kind of, go after or recommend to patients that they get the flu shot, especially if they're in a higher risk category, depending on age and condition and so on and so forth. So anything else on that, Jason? Any other questions?
No, that's great. Thanks, Bob. And actually, Fide, I don't know if you can unmute Brittany. So one question to build off of Brian's presentation. So Brittany, can you talk a little bit more about how the community health worker partnership that you have is, with Watts Health, but also with USC? So different types of entities that we've talked about today, right? We've talked about universities and health centers and managed care organizations and nurse-led, clinics. But how has that CHW program benefited not only your flu vaccination efforts, but also your efforts toward addressing community health? And you may be muted. I don't know, Peter, if you can mute everyone else and maybe have just Brittany's line open.
Okay, there we go. Hi, everyone. My name is Brittany Chen. I am the program manager for the Jobs Plus program in Nickerson Gardens, which is a housing development in the city of Watts in California. First and foremost, I wanted to thank Brian for highlighting the amazing work that Watts Health has been doing around the influenza. But I did want to add on to the work that we've been mobilizing in Nickerson Gardens and Watts around the Twindemic. So our community health workers have been working very vigorously on creating a training platform that we're going to roll out around the Twindemic 2020, and that will be COVID-19 education and the influenza education. And once they present the training series in Nickerson Gardens, we also wanted to add the opportunity for residents to get their shots. So similar to what Bryant was saying, there's a huge fear and lack of trust in the city of Watts around COVID-19 and influenza, the flu vaccine. So it's very important for us to start with education first. And once we do provide that education that comes from residents educating residents, that's how we're able to build our trust in Nickerson Gardens, and then spreading it to the other housing developments that we have in Watts, because we have 3 other housing developments in the city of Watts. So once again, the series will take place in December, and we plan on continuing that Twindemic series for our other developments, because once again, similar to what Bryant was saying, there's a correlation with flu and with COVID-19. And in order for our residents and individuals to understand what's going on, we have to educate them first.
Thank you so much, Brittany. And that's a really, I think, great, innovative partnership, both because it's empowering the community health workers as residents and leaders in their community to be the voice for this public health crisis and helping to connect people to resources, and also I think will create a great resource that maybe other communities might want to look to and model off of. So I really appreciate you sharing that. Do have a comment in here. So I think we're just at about at an hour, so I think we will just move to wrap up. Do folks have any sort of last comments, questions for anyone who's on the line?
Jason, if you have no questions, just one last point, and I'll just throw out there again. There are 1,400 community health centers nationwide. 433 of those, serve residents of public housing or report serving residents of public housing. There are probably a few more that also serve them. So there are an awful lot of potential partners for public housing agencies on the line who are looking for a partner. And it's, again, obviously the priority is flu lead and vaccines, and then moving on to, COVID-19 vaccine, and moving on and also catching up on childhood immunizations. But, as Jerry, mentioned earlier, this is an opportunity to get folks into primary care. And I just hope we'll take it and, just make that extra phone call, even if it didn't, maybe you didn't have luck 2 weeks ago, or maybe your old contact at the health center may have retired or moved on. But I think a little persistence will reap great benefits for the residents and patients that we're all focused on.
Thanks so much, Bob. And just a reminder for folks. Oh, sorry, go ahead.
This is Jerry Whitaker. I just have one more thing that I wanted to add. Community health centers board members are made up of 51% consumers and patients. And so I would encourage those folks at HUD that have resident councils that may be patients of a community health centers to ask them to sit on a board so that they can be the voice.
Yep.
That's a great point. Thank you, Jerry.
I just want to echo that, Jerry. And one thing that, that we're really pushing, and that's reciprocal board membership or at least advisory board membership, so that you kind of institutionalize that relationship, and that, you both know what the other is doing. And so you're kind of aligned in bringing complementary services to those folks. So that's just such a great point.
Sorry, so we have one question actually that just came in from Elizabeth, and she says, thank you, this was very helpful. Are there any resources specifically for the homeless population?
Great question. So, if anyone wants to chime in, so I think one of the things in that guide from Massachusetts that actually speaks to that specifically, and then, I know health centers actually, many of them have grants specifically to serve homeless populations.
Yeah.
Sorry, go ahead, Bob.
Yeah, there are healthcare for the homeless grants that are out there, and if you're interested in finding some information, you can find information on the HRSA website, and you can also go to the Healthcare for the Homeless Council website, which will kind of give you a list of the contacts in your area, or you can go to the Find a Health Center page, on HRSA.gov. So there's a lot of great sources there. And I don't know, Jerry, for example, I don't know, are you guys a Healthcare for the Homeless grantee?
No, we're not, but we work very closely with the county hospital, which has a huge healthcare for the homeless program.
Yep, there's another way to go.
And then this just, again, it's findahealthcenter.hrsa.gov, and this will be linked in the materials, but you can find in here, again, they're one of the populations you see there on the bottom that you can search for resources. So thank you, great question. So just a reminder again for folks that National Influenza Vaccination Week is coming up in 3 weeks. It's December 6th through 12th. So now is really the perfect time, if you're not already working with a health partner in your community, or that you don't already have a vaccine provider, to try and maybe get something together for that week. That is typically the start of the peak for influenza. It carries on through March. So we know the next 4 months are going to be really critical. And this is, the most important time is now at the beginning to avoid having people get infected and then spread throughout the season. So thank you so much to everyone for joining. We will go ahead and close the call, but this is not by any means the end of this. It's really just the start. So thank you all, and we look forward to having you join us on our next webinar.
Thank you.
Thank you, everyone.